Hey everybody, this is Carolyn, and this little mini presentation is on holistic healthcare. It is actually an introduction to the full course, so let's get right into it. I'm going to be talking about holistic health versus integrated health, and I will be discussing what's the difference between the two. Holistic healthcare is a philosophy of treating the whole person, which would include the mind, body, spirit, and lifestyle. But it emphasizes and it has emphasis on prevention, balance, self care. So let me give you an example. Let's take, for instance, let's go with chronic headaches. Chronic headaches, your client or your patient is going to be experiencing stress, maybe some postural dysfunctions. Their nutrition may be involved, a factor in it. And are they getting enough sleep because of the chronic headaches? So it's not just always about treating the pain, or it's not always about where is the pain. What are you doing when the pain is onset? What happens when you no longer feel the pain from a chronic headache? There's other things that's going to be involved with your client. Number one, stress. Stress can cause them to have a headache. If they have any type of cervical conditions, like me, that could cause them to have a headache. Nutrition, if they're not eating properly or they haven't eaten like they should because of everyday things that's going on in their activities of daily living, that may cause them to have chronic headaches. People can cause them to have chronic headaches. Lack of sleep can cause you to have chronic headaches. So these are just some examples that I'm using. Okay. Next, I want to talk about integrative healthcare. Integrative healthcare, on the other hand, is a model of care that combines conventional medicine, which is prescription medicine, with complementary alternative approaches such as massage therapy, such as yoga, such as body work. So I'm going to give an example. Let's say, for instance, you have a patient or a client who has had some type of surgery. I'm going to just use surgery as a broad example. So your client has had surgery. These complementary approaches, in addition to the medication that the medical doctors is going to put them on after surgery, they can receive massage therapy, they can have nutritional guidance, they can register for mindfulness training depending on what type of surgery they had. All this is based on your client's full recovery wellness plan. So, this little mini presentation is a basis for planting seeds for you to think outside the box and helping your clients with a full comprehensive wellness plan. Integrative health focuses on collaboration between healthcare providers for the best outcomes of the clients and or the patients. So this right here, the examples that I gave you for holistic and for integrative, creates a complete picture. Hopefully y'all see what I see. Com- um, Creates a complete picture of health, which addresses our clients' physical body while supporting their mental, while supporting their emotional, and while supporting their emotional, spiritual well-being as well. So think about it. Just therapists, wellness professionals, think outside the box in helping your clients. Next, I want to get into the 5 pillars of holistic health. So I'm going to go into these a little bit, but not in too much detail because I really want you to take the full 2 hour course. It's 2 hours and it's only $37. So there's a lot of information that's in the full course that is not in this mini presentation. So let's talk about the 5 pillars of holistic health. The first one is we're going to talk about is physical. And these are the core pillars. Massage therapists and wellness professionals. These are the core 5 pillars of holistic health. So the first one up here is physical. Physical is going to include body work, exercise, nutrition, and sleep. Those are the physical pillars. Next is on here is mental. Mental is about mindfulness, cognitive balance, thinking, relaxation techniques. Next on here is social. We're here is social. Social is going to include support networks, which is very important to a person. If a person doesn't feel like they have any type of support with things that is going on in their life, that can cause them to have stress. If stress is there, that may cause them to have headaches of some type. You see how it's a ripple effect? In addition to support networks is relationships. What type of relationships do our clients have? And I'm going to put this in there. What type of relationships do we have with the people that touches our life? Whether they're co-workers, whether they're friends, whether they're associates, whether they're relatives, whether they're uncles, aunties, mom, dad, sister, brother, nephew. What type of relationship do we have with these type individuals that touch our life on an everyday basis? And last in social is community. Once again, with community, is our clients / patients involved in any type of community activities? Do they engage in those activities? So I'm going to ask you, put yourself in the client's place. Are you involved in community? And if you are, what are you doing in the community that you're involved in? Do you give more than you take? Or are you a taker? Which means you are always on the receiving end and not on the giving end. And if you are a person that is always giving to your community and you're not what's the word that I want to use? You're not being reciprocated, and you always find yourself giving till you realize people are in gimme city and they are not reciprocating. We know people like that and we have relatives like that. That's community. Next on here is spiritual. Spiritual is connection with our higher being. Our clients / patients has some type of connection. We all do. Has some connection with a higher being. And most importantly, we all have a purpose here. We didn't ask to be born, but we definitely have a purpose while we are here. And remember, I'm just talking about the spiritual pillar of health right now. Meditation. Meditation calms the nervous system. And there is enough software out there that teaches people how to meditate. Then there's coaches out there. One I could think off the top of my head because she's a personal friend. She does early morning, I think like 6 o'clock in the morning, meditation classes. And she started out small, but her community has grown where she does guided meditation strictly online. Now I'm gonna share this with you. Share this with your clients as well, because everybody don't know how to meditate, but we all have a phone, whether it's an old-fashioned phone like cell phone or it's a smartphone, Android, iPhone, whatever. And then there is social media, YouTube. There are videos out there that will teach your client how to do guided meditation and what steps to take to do it. You, as the professional, as a massage therapist or as a wellness professional, here we go again, thinking outside the box here. You, as the wellness professional or the massage therapist, you can get trained up in meditation skills and start hosting meditation classes to your clients. Once again, thinking outside the box, everybody. Thinking outside the box. Lastly, we have emotional. Emotional is all about stress management, resilience, and self care. Most importantly, stress management and self care. And not enough of us do self care, including me. By prescription, I'm supposed to be doing self care. By prescription, I'm supposed to be getting a massage on a weekly basis. By prescription. Self care is so important. What can we do for our clients in our scope of practice for our client self care other than offer them relaxation massage techniques? What else can we offer our clients outside of massage therapy, but it's still within our scope of practice? Wellness professionals, you are broad. So, what I'm about to mention, I'm sure you can do it too. But if you decide to do any of these things, take the certification courses so that you can perfect it and offer it to your clients if you are already not certified in what I'm about to say when it comes to self-care. So, one of the ones that I'm going to mention is foot reflexology. Foot reflexology is a self-care. It's a modality in the massage therapy realm. It is a modality that stands by itself, but to a client, that's self-care. To us, it is self-care. Why? Because we are on our Jack and Jills all day long. Some people are on their Jack and Jill, meaning your 2 feet, for 16 hours a day, especially if they have employment where they either walking for long periods of time or they are standing on their feet for long periods of time. So reflexology or a soft foot spa with lavender essential oil, that is also self-care. It's all self-care. What else can we offer our clients for self-care? Coming in to get services for a relaxation technique with hot stone massage. That is self-care. For massage therapists that is not hot stone certified or have not been trained in hot stone, I suggest that you do it as part of a client's self-care than other straight cookie cutter massage. And don't get upset with me when I say cookie cutter massage. It is what it is. What else can we offer our clients on the self-care realm? Our clients have tight muscles. How many are them receiving some type of stretching? Some type of stretching. Massage therapist, I got to go with you here. Now, when it comes to stretching, depending on what school you went to, foundation school, or what advanced training you have taken in continuing education classes, why are you not offering stretching as a class for self-care to your clients? You can do it. It's within your scope of practice. You can do it. Other than you stretching your clients, you can hold a class where you are teaching your clients self-care stretches, and you hold a class on self-care stretching. If I did it, I know you could do it. And I did it in my early years as a massage therapist. So why not do it? Those are just some of the examples of self-care. So we've covered physical, we've covered mental, we've covered social, we've covered spiritual, and lastly, we have covered emotional. So next is, what is massage therapist's place in holistic health? Let's talk a little bit about that. Our role as massage therapists and wellness professionals, y'all included too. Wellness professionals are people who serve individuals in the health and in their health and wellness. You may not be a massage therapist, licensed massage therapist, but you do serve the community. You are a public servant just like us in the health and wellness profession. You may be a health coach. Just using that as an example. So, therapists, our role in pain management, stress relief, and as I go through these, I want y'all to think about this: recovery and preventive health care. Think about our scope of practice as licensees of the state. Do we have a role in all of this when we're delivering our services? Do we have a role in pain management? Do we have a role in stress relief? Do we have a role in recovery? Depending on what's going on with our clients and what type of health condition they're in, what type of medical procedures they have undergone. Are we about preventive care? We are. And because we are, our role in this, that's why continuing education is so important, so that you can stay abreast of what's going on in the industry, as well as increase your skill set with your clients. Hope y'all understand what I'm saying. All right. How massage interacts with the nervous system, which is our foundation system. Let something go wrong with that nervous system, we got all kinds of problems. Circulatory system, lymphatic system, our detox system, our heart system, foundation system, nervous system, circulatory system, all about the blood. Lymphatic system runs along the same pathway as the circulatory system, but the lymphatic system is all about waste and getting rid of extracellular fluid. So this whole thing, holistic health, is about supporting the whole person for wellness. And as I did my research, communities, men, women, is looking for comprehensive wellness providers. I hope y'all getting this. Comprehensive wellness providers. That means if you are a massage therapist and you have the mentality, like I have heard so many, I'm a massage therapist. I don't do that. That's not in my scope of practice. I've heard therapists say this. And here's the thing, therapist that has that thinking line, you are missing out. And what I mean by that, you're missing out when it comes to the whole comprehensive wellness. It's okay if you want to stay where you're at. That's okay. But if you want to service your clients and you want them with you and they're not going to go see somebody else, you have to, not have to, but you should be interested in, well, what else can I do to serve my client? Because we're service providers as massage therapists, as wellness professionals, as health and wellness professionals. We are public servants of our communities, regardless of where you're serving at. We are licensed by the state public servants of the people we serve. And we are under congressional laws. Those state laws passed from Congress, created by state boards. We are the licensees. Those boards are put in place to make sure that we stay in compliance with the law. Those boards are put in place to make sure that the public is protected from licensees who do anything that is going to bring them harm or anything that is outside the scope of practice that they should not be doing, such as chiropractic work. I use that as an example because you do got some therapists that's doing chiropractic work and they're not chiropractors. Different if you're dual status, but if you're not dual status, you should not be doing it. So, moving right along. Just saying, just saying. The holistic health course steps you into a whole person care with this online 2-hour training designed exclusively for massage therapists and wellness professionals. It goes beyond treating the symptoms, discover how to support clients through the 5 pillars of holistic health. Learn actionable strategies you can apply immediately, elevate your practice, and expand client impact. Invest in your growth for only $37. This course that I created for 2 hours, I priced it at $37 to make it affordable for any and everybody in the healthcare industry and massage therapists who is interested in taking it to another plane. The regular price of this course is $197, and it's about the value that's in the course. So you may say, "Oh, Carol, $197 is too much money." When you take a course, whether it's a FREE99 like this one or it's a paid course, I want you to think about the value that you're getting out of that course. And that's another thing. It's about mindset. What type of mindset a person has to determine if they want to do something or not. And that's in everyday life. But when it comes to education, I'm big on education because I'm an educator. I'm an educator from 4th through 12th grade, through college, through trade school. So I've taught primary kids in a school district. I've taught trade schools, cosmetology, as well as massage therapy schools, and I've taught at colleges. So when it comes to education, I'm big on education. And when it comes to learning, and if you find a course that you are interested in or anything that you're interested in, Don't so much think about the price. Think about the value of what you're getting out of the course. And if you need to, like I always tell people, if you need to, you can call me up and you can ask me questions about the course that you want to take with me. And a lot of times, if it's a CE course, I'll send you my provider number so you can go on the internet and research me with my provider number once I give you the website of where to go, because I am governed by a larger body. Okay, so that's some information that I wanted to share. Hopefully, if you have received value out of the information that I have given to help you, then register for this 2-hour course for only $37. If you have any questions about this mini course, this mini presentation, please do not hesitate to reach out and DM me on the website or send me a direct message at I am on Instagram affiliate. If you're on Instagram, you want to look for Carolyn underscore the educator and send me a direct message. If you're connected with me on Facebook, that's easy. Just go to my Facebook page and send me an IM. If you're in my Facebook group, you know what you can do. Just connect with me there. If you're on my YouTube pages, connect with me there. If you're on Spotify and you want to leave some information, because this is also going to be on Spotify, on the podcast for Massage Educator and a Mic, you could put your comments and ask me there. You can also go to my television networks. I have 2. You can go to both of them and reach me there. So that's my time, everybody. I will see you or hear from you or give you some more valuable information in the next broadcast. Take care, stay safe, be blessed. Bye bye.